Chair.
Thank you. I've got two more testifiers here, but are you guys going to be around for a few minutes?
Sure.
Okay, we should be in no more than 10 minutes.
Yeah.
Donald, thank you. Okay, so next up, I believe they're going to be on Zoom, is that correct? I've got Dr. Moore, Dr. Jacqueline Moore. We just, Senator Representative Pollard did a great job. We had a site visit to their dispensary, so I thought it would be prudent to have her here, talk about medical cannabis. She could not make it, so she has Dr. Craig Pollard that will be in her stead, so. He's up.
Yeah, aloha, committee chairs, vice
Thanks
chairs.
for being here.
Absolutely, thanks so much for having me. So I would just like to take a moment to share that my thoughts are with all members that are from and the people of Maui during this difficult time. But thank you for the opportunity to speak here today. I'm extremely passionate about this subject matter, having worked as a community pharmacist here in Hawaii for most of my professional career. So my name is Dr. Craig Pollard. I received my doctorate of pharmacy from Rutgers University, and I'm currently working as Senior Director of Production for Big Island Grown, one of Hawaii's 8 medical cannabis licensees. A little background, I practiced community pharmacy in Hawaii for almost 10 years. Most of those years at a community pharmacy in a small town on the Big Island. Want to get a great understanding of how bad the opioid epidemic is here in Hawaii? Ask your local pharmacist. We see patients from all walks of life day in and day out. Want to know how bad this affects individual communities? Ask a pharmacist that has practiced in the same community for years. They know colleagues who have been robbed at gunpoint for these drugs. They have had to call EMS to attend to patients overdosing in their bathrooms. And sadly, they've filled prescriptions that have led to accidental overdose deaths. So let's dive into some of the stats. The Hawaii Opioid Initiative reports that there were over 150,000 opioid prescriptions filled in the state of Hawaii in the last quarter. That's over 600,000 opioid prescriptions that will be filled this year alone. And opioids are highly addictive, as we know, and can lead to long-term opioid use in as little as 5 days. So what can we do? What do we need to do? We need to responsibly reduce the amount of opioids that are dispensed and have viable alternatives presented to patients prior to their first opioid prescription being filled. How can we do it? Cannabinoids can help. From published studies, we know cannabinoids have multimodal mechanisms of action, producing analgesia, including modulation of neuronal nociceptive processing, inhibition of pro-inflammatory molecule release, inhibition of mast cell activation, and modulation of endogenous opioid receptors in primary afferent pathways. So what does that mean? Cannabinoids help with pain. So how do we get our chronic pain patients to ingest cannabinoids? One of the ways is to increase access to cannabis. And there's precedent for this. There's a variety of cohort studies from other states that reviewed their state prescription monitoring program data that show a reduction in the morphine milliequivalents of patients that are enrolled in the state's medical cannabis program versus control groups. New Mexico reviewed patient data from around 70 patients, about half of which were enrolled in their medical cannabis program. Medical cannabis program enrollment was associated with 17 times higher odds of ceasing opioid prescriptions, 5 times higher odds of reducing daily prescription opioid dosages, and a 47% reduction in daily opioid dosages, relative to a mean change of a positive 10% in the comparison group. New York State monitored their PMP from 2017 to 2019. Over 12,000 patients were included in this study, divided between the medical cannabis exposure group and the non-exposure group. During follow-up, significantly greater reductions in opioid dosage were observed among the exposure group. The daily morphine milliequivalent for the last month of follow-up among patients receiving medical cannabis was reduced by up to 48% compared with baseline dosages. And among individuals in the non-exposure group, the daily morphine milliequivalent was reduced by as little as 4%. Lastly, and much more anecdotally, I'm seeing cannabis help increase patients' quality of life. In the same community with those same patients who I dispensed opioid prescriptions to for years. One patient that comes to mind, a male in his early 50s. He was on over 120 morphine milliequivalents per day when I last saw him at the pharmacy. About 2 years later, I ran into him at the local farmer's market, and he came right up to me to say, "Thank you for what you're doing." Of course, I asked him if he had been to the dispensary, and to that he replied, "Been there. That's all I use for my pain now. I'm completely off pain pills." I couldn't believe it. I mean, I knew cannabis could help, but for a patient on these doses to now be opioid free, incredible. Beyond my wildest dreams of what could be possible, but exactly the reason I took the leap into the world of cannabis. I do want to personally thank the members present today that were responsible for passing our medical cannabis dispensary law in 2015 so that stories like the one I just shared are even possible in our state. Okay, so let's talk barriers. Cannabis as an alternative therapy is not covered by insurance, between doctor's appointments to medication costs to registration. A consideration, is medical cannabis treated as a medicine or as an illicit drug in our state medical system during a medication reconciliation at our hospitals? Patients have to go to special certifying providers and in some cases fear even informing their primary care providers. And the ultimate crux of the issue, it is still easier to get access to an opioid prescription in this state than it is clean, tested cannabis, and until that's not the case, there is work to be done. In short, we need a state-supported initiative advocating that cannabis should be considered as a viable alternative and adjunct to opioids and as a potential partner in helping to reduce overall opioid doses, which could lead to a reduction in opioid-related morbidity and mortality. I want to thank you guys for your time and attention. Again, I really appreciate the opportunity to speak here today. Please don't hesitate to reach out with any questions.
Thank you, Craig. Chair Bellotti, did you have any questions?
I don't think I do at the time, but thank you, Dr. Pollard, for joining us. And I just want to also say, we know that there were wildfires also on the Big Island, and so that's not been gone unnoticed by folks here at the legislature. And, you know, I think everyone is traumatized across the state.
Yeah,
So
yes,
thank you for joining us and being so patient for this very long information.
Absolutely, absolutely.
Right.
I appreciate your thoughts and the opportunity. Thank you.
Craig, and of course, Chair Bellotti led the site visit a couple weeks ago on the Big Island to your dispensary. Could you please let Dr. Jacqueline Moore know, give her our best. Hope she's feeling better, and thank you. And by the way, that was Chair Bellotti that led that movement to pass that bill back in 2015. She's too shy or humble to say anything, but Doctor, thank you so much. Appreciate you.
Yeah, thank you for those kind words, and Chair Bellotti, thank you so much for your work on that bill, and appreciate all you guys do.
Right. Thanks again for the site visit. That was great. We're down to our last testifier.